All right. Apologies again. Looks like we were kicked out again, guys. Nate, you there? Just bear with us for a moment, guys. Sorry.
No problem.
Everyone just joined here. Dr. Bond gave you presenter rights just now.
Okay. All right, so let me just. Okay. So is everyone able to see the slides?
Yes, I can on my end. And I would say, in the interest of time, Dr. Bodden, if you want to go ahead and blast off with your segment, let's do that, and we can kind of cut through ours.
Okay, no worries. All right. Okay, so you'll go through this part at the end then.
Right, if there's time, and if we don't, it's okay. But as I was saying in the introduction, I was able to give you the entity OnCourse and you guys' name. But if you can just tell us a little bit more about your credentials and your specialties in the clinical world, you can go for it.
Yeah, sure. All right, we are thrilled to be here with you guys today. So I'm Dr. Alexandra Bodden. I am a clinical psychologist. I am also the owner of OnCourse Cayman. So here we provide therapy and testing for children, teens, and adults. We also do corporate workshops and trainings, and I actually offer therapy using horses, which is a fun twist on things. My specializations is working with adults with a history of trauma or violence or abuse, as well as working with addictions. Thrilled to be joined by Dr. Angelova today, who's our new psychologist at the practice as well. I know you guys aren't able to see, I'm actually 9 months pregnant. So happy to be here. And just in case I couldn't make it, I brought my backup, which is Dr. Angelova, who's a brilliant new psychologist who's joining us and actually brings with her several other specialties. I'll just give her a second just to let you know a little bit more about herself.
Okay. Hi, everybody. It's lovely to be here. Thank you, Dr. Bodden and Glenn and Nathan for this opportunity. I'm a counseling psychologist. I'm specializing in trauma and assessment. I'm from South Africa, and hopefully I'll be on Cayman as soon as the next month. And yeah, we're holding our thumbs for the borders to open, and so that I don't have to be in quarantine for 14 days. So yes, I'm looking forward to working with OnCourse on Cayman and with Dr. Bodden. And I have been registered for 21 years, and so I'm hoping to bring some specialities and specifically related to the environment on the Cayman Islands.
Yeah. Yes, thank you. We're excited for what you bring to the practice, but also to the island as a whole. And so we actually had a discussion question here, so you guys can pop the answers, I believe, into the chat. So what does good emotional health look like to you? What are things that come to mind when you think about your emotional health and well-being? You guys can either put it in the chat, or if you want, you can, or you can say it out. All right.
Dr. Bodden, I'm not seeing anything in the chat.
Okay.
So I was wondering if everybody's seeing the chat, and if everybody can actually know that they can type in the chat. And yeah.
Okay. Yeah. So we got one for energy, and that can often be a big part of it. If we're stressed, we might have a drop in energy, and we're feeling good about things, we might have some good energy that comes with it as well. So that's a great idea. Smiles and good conversations. Yeah, so actually you guys have actually kind of captured the whole realm of what we'll be looking at today. In psychology, we look at what we call the biopsychosocial model. So with our mental health, there's actually a lot of different aspects that come into play. And so with that, what we'll be looking at today is going to be looking at the physical aspects, the emotional aspects, as well as the social parts of our overall emotional health and well-being. So a quick overview, and what we're going to do is give you guys just kind of a quick tour of different things that we're able to offer and that psychology and counselors and therapists are able to help with, as well as we're going to drop in a few tidbits and tips as we go. So looking in the physical realm, we'll be looking at sleep hygiene, relaxation and exercise, as well as healthy versus not so healthy habits. In the emotional realm, we'll be looking at active coping skills, changing negative thoughts, as well as mindfulness, which is a hot topic these days. And our social health will be looking at improving communication, conflict resolution skills, as well as ways of building social support and increasing the number of helpful and supportive people around us. All right, so beginning with our physical health. And I think that this is a really important part. So especially I know that you guys are from all across the Caribbean. I'm also Caymanian, and having grown up in Cayman and now working in Cayman, my experience is that a lot of our clients, whatever is going on, whether it is just stress or anxiety, depression, a lot of times the stress comes out in our bodies. Right, so whether it's going to be stomach aches, headaches, there's a very strong physical component that comes with any kinds of stress or mental health symptoms as well. So looking at the physical side first. Sleep is often one of the first things to go. And when I've done blogs and talks on this before, this has always been one of the big ones, and definitely something that I tend to go through with pretty much everyone that I work with. So sleep hygiene is what we call it, and this looks at behavioral ways of being able to improve our sleep. All right, so psychologists, counselors, therapists, we tend to work within talk therapy and thoughts, feelings, and behaviors. So we don't do medications. Medications are often helpful with sleep, but there's a lot that we can offer as well to work with you to improve your habits during the day as well as during the evening to be able to improve your sleep. So this set of skills comes from behaviorism, which is looking at our body's association with things. And a lot of times when we have insomnia, all right, what happens? We get into bed where our mind starts racing, what we didn't get done, what we still need to do tomorrow, what we should have done better today. I saw a meme the other day with the Baby Shark song with our mind at 3 a.m. And so with insomnia, difficulty sleeping, it's very hard, and we very quickly can get into really difficult patterns that are not very helpful. And what happens is that our body learns routines very quickly. So if we get into the habit of getting into bed, laying there worrying about things or watching TV or playing on social media, whatever your choice is there, for a few hours, the body then learns that we get to bed, we spend a couple hours doing this, and then maybe we go to sleep. So with sleep hygiene, we work with people to help them understand that our bodies learn things based on the patterns that we develop, and help them to come up with a more helpful bedtime routine. So things like getting out of bed, if you're not asleep within 30 minutes, going somewhere else and then coming back, to help your body learn that when you get into bed, it's time to sleep. As well as even some little things during the day, such as cutting back on caffeine or getting some exercise, can help your body to be better prepared for getting to sleep at night. And Dr. Angelova, I'm not sure if you had anything else you wanted to throw in for this one.
You've mentioned quite a lot of the good sleeping habits. I think what is really important is to get regular, to get into a routine. Anything in our lives that are in a routine is kind of something that we organize and that we've got under control. So getting it into a routine, and then using your bed for sleeping, not using your bed to work on or to watch TV in, so that you can your brain can start making the connection between this is where I sleep and this is where I don't sleep. And then just sleeping rituals, like maybe before bed doing some relaxation, or doing some breathing exercises just for 15 minutes, not having caffeine before bedtime and things like that. And then if you didn't have a good night's rest the previous night, try not to take naps during the day, but rather try to get a better night's sleep. So when you're extremely tired, is when you will start sleeping better.
The no naps one is the one that my clients normally hate. When you need no nap. And so it's all about, retraining our body. And so a lot of the work that we do with cognitive behavioral therapy, as well as dialectical behavior therapy, is about retraining our mind and body into more helpful patterns. So the difficulties with sleep, as well as the things like stomach aches and headaches, actually come from the body's stress response, right? So our body gears up with the fight or flight response. Evolutionarily wise, it was to either run from a lion or fight it. So our body gears up with a lot of adrenaline, which is what causes a lot of these physical changes, and a lot of times the difficulty sleeping as well. So they couldn't have two therapists come on here and not talk about deep breathing. So relaxation is one of the tools that we have that helps the body to relax and reduces the physiological arousal, right? So the tension that we hold in our body. It's not possible to be tense and relaxed at the same time. So physically helping our body to relax will then help our mind to relax. And this can be done a number of different ways, through deep breathing exercises, imagery, as well as progressive muscle relaxation. So there's a number of exercises that we can do. We're going to practice one today. But the relaxation exercises teaches our body how to relax, and that it's okay to relax. In today's world and society with so much stress on us, many of us live under chronic stress. So it can be hard for the body to relax and let things go, because it feels like if it lets its guard down, something bad is going to happen. Exercise, I consider a twofer. It helps to reduce the physical tension, also builds endorphins, and so helps us feel more positive about ourselves. And if we lose a little weight in the process, all the better. and that can be anything. And I recommend everyone try different things until you find out what's going to work for you. So I did just want to practice what I call 4-4-8 breathing. It's my favorite kind of deep breathing, because it not only helps us to make sure that we're breathing deeply and consistently, the emphasis on the exhale to get the old air out, but it also has counting, especially for those sleepless nights. I find this one really helpful, or things like preparing for an exam or a big presentation. It's a great way to stop the thoughts as well. So if it's okay, we'll just practice together, and we'll just do 3 breaths. I'll count for you, in through your nose, out through your mouth. And we're going to breathe in for 4 counts, hold for 4 counts, and then breathe out for 8. So all together now, we're going to breathe in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, 8. How's everyone feeling? I always like to make people try it because everyone normally goes, deep breathing doesn't work for me, been there, done that. But it's actually, or I'll do it later. But to actually practice it gives us a chance to feel it, see if it's going to be one of the ones that work for us. And it makes it easier to remember it the next time as well. I had a friend that came back and said the 402 breathing was great. And I was like, no, you clean your bathroom with 402, you breathe 448. So it gives you a chance just to practice and give it a shot. And there's different numbers. I think Dr. Angelova, I think you've got a different set of numbers that you tend to use as well.
Yes, I try to use the 6-2-7. So it's 6 breaths in, hold for 2, and then 7 out. So they basically do the same thing, but different rhythms just work for different people. I also think what's important is that when you're doing this breathing, it shouldn't just be in your lungs. It should be actually in your diaphragm. So your diaphragm must raise, and then when you blow out or you release, exhale, your diaphragm must settle again. So that's what makes it deep breathing. It's actually not just in the lungs.
Yeah. And of course, the big thing with this is that relaxation takes practice. It seems counterintuitive. You should be able to relax, right? Just relax. But it's actually something that takes time and practice. So Dr. Angelova and I work with clients or with teams. We'll often go in with several different exercises to be able to learn, to be able to show different ways of being able to use the strategies, whether it's this or imagery or even the tensing and relaxing muscles with progressive muscle relaxation, to help them figure out what's going to be right for them.
Yeah.
All right. Okay, healthy and not so healthy habits. So we said that with our approaches, a lot of it is changing behaviors. So Dr. Angelova, if you want to go through some of the healthy habits, and then I'll take on the other side.
Yeah, some of the healthy habits to remain mentally healthy. The first one is getting enough sleep, and that usually is a big problem. When you are not mentally healthy, probably one of your symptoms will be insomnia. And pretty much the way you feel when you're awake will be determined by the kind of sleep that you got. And so if you've had a good night's sleep, you'd have good concentration, and that will help you at work because you'll be more productive. Whereas if you didn't get a good night's sleep, probably you're going to feel really tired. You're not going to be concentrating, making unnecessary mistakes. So it influences eventually your whole life. It also, good sleep improves your immune system. So it helps when we go back to the biopsychosocial model, it goes back to increasing physical health. Poor sleep is correlated with heart disease and strokes on a physical level, and on an emotional level, it correlates with depression and anxiety. So it's very important to get enough sleep. And people often ask me, but what is enough sleep? I have a friend who sleeps 4 hours a night, and he swears that that is good for him, and he actually doesn't want to sleep more. And he's productive. He's a very high functioning individual. But then the average amount of sleep that people say or research says that we need is about 8 hours sleep. And we must also remember that it's not only the amount of hours that you sleep, but in your sleep, you have a sleep cycle, and you have 4 phases in that cycle. And it's important to go through all 4 of the phases. So if you're waking and sleeping, then you're not going through all the phases. And then that's also going to affect your sleeping pattern and your general functioning. Then we've got eating well. I don't know if I really need to say much about that. I think everybody knows. If you have bad eating habits, this will influence your lifestyle, and that influences every part of your being. So good nutrition leads to a good lifestyle. It also prevents disease, again, on a physical level and on an emotional level, if we go back to our biopsychosocial model. And often, psychological disorders, for instance, depression, can be linked to having a chemical imbalance in the brain. And not all of people can, just by eating correctly, correct these imbalances, but eating correctly and eating healthily and nutritionally certainly can go a long way in helping you with your chemical imbalances, and therefore helping you with depression. Then exercising is very important. We heard about the endorphins just now. So when you're doing exercise, you are releasing feel-good hormones, and these are called endorphins. So when you have these endorphins, you are less likely to be depressed and anxious. And exercise also makes you tired. So it helps with insomnia. Okay, and then we look at the time, spending time with supportive people. So research says that if you have a strong support system, it reduces your stress, which is also reducing depression and anxiety, and it increases coping skills. So as we all know, nobody of us has a stress-free life, but at least if we have some coping skills that we can cope with, we're on a good path. And what I always say to people is, just have a voice. Don't suffer in silence. When it's hard for you, go to somebody, talk to and talk to them, and that's where your support system comes in. And it's only when you are talking and having a support system that people know what you're battling with, and then they're going to know where they must support you. So it's very important to have a support system that you can talk to. And then doing things that we enjoy. So doing things that we enjoy just brings balance to our life. We can't be just working all the time. So it's important to know that we have to work and we have to play. And when we're working hard and playing hard, we can have a good balance. You don't want to get to a position where you're working all the time and you're wishing, I wish I could play, or I wish I could just have some time off. And then when you have time off, you're thinking of, but I haven't done this work and I really need to get to this work. So that creates a huge imbalance. Yeah, I also think that doing things we enjoy, if you see yourself like a jug and every day you're pouring a little bit of water onto everybody else and giving to everybody else, and eventually your jug will be empty and you'll have nothing to give. But if you're doing things that you enjoy, you're actually filling your jug. You replenishing your energy, and then you can give to others again. And when you feel replenished, you're just going to feel better and you're going to feel healthy.
Yeah.
Dr. Bottom, I don't know if you want to add to that.
Yeah, no, it's so true. And I think the hardest part with that is that a lot of times what I hear is, well, when I feel better, I will hang out with friends, or when I feel better, I will, get back to playing tennis, or whatever it is that we enjoy. I think that that's, from our perspective, understanding that when people go under stress, a lot of these not so healthy habits I'm going to talk about tend to come up. But rather than waiting till we feel better to do the good things, it's actually doing those things that we used to enjoy, or connecting with people that can actually help to bring us through it. So when we go through stress, we often get changes in our behaviors, right? So whether it's difficulty sleeping, difficulties with changes in appetite, eating more, eating less, eating junk food, whatever it is for you, Burger King, ice cream and French fries tends to be mine. So whatever it is for us, we probably know our kind of go-to stress habits. Over reliance on caffeine, not spending time with the people that we used to spend time with, or doing the activities that we used to enjoy because we don't have time, we don't have the energy. And I think it's important to know that all of these can come with being overwhelmed with stress, as well as with things like anxiety and depression. So all of these can be signs that we are beginning to struggle with our mental health and what's going on around us. Some people will come in for support specifically for these things, especially things like substance use. I know with the COVID lockdown and now the transition back, there's been phenomenal stressors on everyone in the society. Wellbeing has done a great job of keeping everyone safe. There has been, significant changes that we've all had to go through for it. And the other countries, all the countries around us, I know, are going through very similar stressors. So people may come in to look at changing their substance use habits, or maybe that changes in diet and maybe over-reliance on caffeine is something that's come with their kind of stress. And so I think it's important to know that all these things come up. It's not because you're a bad person or because you're weak. But not so healthy habits are things that we use as go-tos to help us feel better in the moment, right? So we feel better short term, but longer term, they cause negative consequences, right? Whether it's an impact on our health, an impact on our weight, or even potentially legal or other consequences if we get into things like drug use. So when we work with people, we can help them identify these patterns. And it's important to realize that what that behavior is doing for us. And I think that that's, so in my work with addictions, that's something that I often, that's one of the things that I'm curious about when people come in is, what does that do for you, right? Is it that the junk food helps you to feel more calm or to feel happier about things? Is it that smoking gives you a chance to go outside and talk to people, right? Is it that drinking is a way of you feeling more comfortable in social situations? So one of the things that we can do in therapy is going to be looking at, what does this behavior do for you? And what are other ways of meeting those needs? And as we're doing that, we'll be bringing in the healthy habits, because the way the mind works for humans is that it's easier to focus on what to do than what not to do. So as we're figuring out and understanding the not so healthy habits, we'll be actively working to bring in the healthy habits as well to keep us moving forward. Yes. So these are some of the behavioral and physical changes that we go through. All right, so looking at our emotional health, as I said, Dr. Angelova and I both operate, while we both pull from from a variety of approaches. Cognitive behavioral therapy and dialectical behavior therapy are two of our mainstays, which a lot of the focus then is on active coping skills. And which is going to be things like recognizing triggers for difficult emotions. So what's, you know, it's one thing to say that, you know, I had a really difficult night last night, but what was going on, right? What was happening to you, around you, with the people around you that you were thinking or thinking about when you started having those kinds of feelings? Recognizing signs of distress or stress in ourselves, so that if we can catch ourselves, I often use a 0 to 10 scale with clients, 0 not stressed at all, 10 most stressed you've ever been. If we can catch ourselves at like a 5, we have a much better chance of being able to calm back down and do something helpful in the situation. And if we don't catch it, to where a 9 or a 10. And with that, it's going to be, you know, once we catch ourselves, taking active steps to reduce the stress, whether it's going to be some of the physical aspects that we talked about or some of the emotional skills that we'll do. And Dr. Angela, if you want to share a little bit about the CBT and the DBT approach and how we use the active coping skills.
Yeah. So what I think is important is to realize that we have triggers, internal triggers and external triggers. So an external trigger would be something like a police siren. It can, you know, trigger something in you, or the smell of fresh bread might make you think of my mom's home when, you know, and you might, you know, start longing for home and things like that. Internal triggers are when you kind of have an anxiety in a specific situation and nobody else is experiencing anxiety in that situation, then you realize it's internal, it's in your own head, and that's something that you need to go and find out for yourself, or with the help of a therapist. It's also easier to stay mindful when you're busy doing this. So kind of stay in the rational mind where you're thinking about it and where you're not necessarily switching over to the emotional mind where you're just bombarded with emotions and you're not thinking about what happened and how it happened and what are the facts around the situation. Also identifying distress and in ourselves. Sometimes it's difficult, but sometimes you can just kind of have a look at, am I the same person I used to be 3 months ago? Or am I feeling perhaps specifically overburdened at this time? If you're unable to enjoy your life, your social interactions, your family, or if you have disinterest in life, nothing motivates you to get out of bed in the morning. Sometimes people see it in a loss of humor. You had a great sense of humor and suddenly things are just not so funny anymore, and you're not making any jokes anymore. And small things frustrate you that never used to frustrate you, like somebody just slams a door and you kind of just feel irritated and itchy, and you never used to be like that. Then you've got to realize, okay, something in me is changing and this might be distress. And in terms of taking active steps to reduce stress, so I use DBT. Dr. Bodden uses also CBT and DBT, and there are specific steps and techniques that we use. The one for DBT is actually called distress tolerance, and it focuses a lot on relaxation, problem solving, deep breathing. If anxiety is the major problem, there's one technique called grounding. And those are techniques that are taught to you by professionals, but that you can really take into the rest of your life as well. So it's quite it gives you a very broad spectrum of coping skills on how to cope with distress.
And I think that's my favorite part about these approaches, is that it helps you to understand and to help yourself. So there are things that you will take home that you can use at a later time. Should things like anxiety or depression or just, you know, stress in general come back at a later time. And if anyone does find a happiness button, please let me know. Make my job even easier. So a lot of times we'll start with the active coping skills for managing the stress in the here and now. One of the other techniques that we'll bring in is the cognitive side of things. So with cognitive theory, and this DBT is also the foundation for DBT, so the two are very closely related. We believe that it's irrational thoughts or negative automatic thoughts that affect our feelings and our mood. So if we look at a situation and we tend to see things we call like very black and white, that, you know, I only got a 98 on the test, and that's no good, right? So having high expectations where either we are a success or we're a failure is black and white thinking, which can be very hard. We have even some things like overgeneralization, you know, thinking because we got a poor review or poor comment on our review that overall we're a bad employee. Then those kinds of things can really hurt our self-esteem and hurt our mood. So one of the things that we'll do is helping clients recognize when we have some of these cognitive distortions going on or negative automatic thoughts, helping them to recognize them, and then do some work to rebalance or restructure them as well. So a lot of times these happen just automatically. I'm no good. No one likes me. I'm never good enough. I can't do anything right. These are things that tend to come up automatically based on our personalities, our past experiences. And so recognizing them is the first step, and then being able to do some work to separate the thoughts and the feelings, so recognizing that the feeling might be sadness or shame or guilt. The thoughts would be, you know, I can't do anything right, or no one cares about me. And then taking the thought and bringing in information that we miss when we get emotional. And that's a process we call cognitive restructuring. So taking the situation, kind of stepping back from it, and changing what we're saying to ourselves or what we're thinking to create a more balanced perspective, which may be that, you know, while I got some constructive feedback on this aspect on my work review, you know, I can see there's a lot of things that my boss really appreciates about me. And I think these are some areas that I can grow into. So in that way, it's kind of really taking a step back and looking at the bigger picture to help us not just zero in on the details or the negative parts, especially, of the situation. An example I'll sometimes give as well is that if we are driving and someone cuts us off, what do we think, right? Normally we get angry, we feel very frustrated. Do you believe this guy? We get to work, you won't believe what happened on the way to work today. And so I tell clients, if you found out that person was rushing to the hospital with a sick family member, would your perspective have been different? And this is where clients get upset with me and they tell me, well, you're letting them off. And so I tell them, you know, either it's true and it's not worth us being upset, or he's just not a nice person and we don't really need to waste our time and energy on them anyway. I'm not sure if I'm allowed to use any of the other words that might come to mind in that situation. But either way, it's not worth our time and energy and for us to spend our whole morning worried about it. So while we often begin doing this after the fact, you know, after situations have brought on the automatic thoughts and we've kind of gone down the rabbit hole, I call it, the goal is that as we get into situations and we're practicing these strategies, so we're able to then restructure in the moment to be like, either there's an emergency or it's not something I need to worry about. That's a him problem. And focusing on back on ourselves and doing what we're doing. So that's a process we call cognitive restructuring. And with that, a lot of times we'll have, as I think Mr. Nathan was pointing out today, talking about gratitudes. So in order to augment that process with clients, we'll often have them actively looking for the good things, right? And that gives us more to work with then when we are doing this restructuring process. So looking for successes, looking for things that went well, things that we're grateful for, the things that we do well and that are our strengths. Because a lot of times the human brain is wired to focus on the negative, what we didn't get done and what we should have done differently. So even a gratitude journal is a great way to, the end of the day, write down 3 things that went well. If anyone tries that, I recommend picking different things and being specific. So that way when days feel like nothing ever goes right, you've actually got a whole book of things that have gone well in your own writing and in your own words. So this is the cognitive restructuring part of things, and that's how we bring in some gratitude with what we do as well. Okay. And so with mindfulness, which is a hot topic these days, this is actually about being present, being in the moment. You guys may have heard of it with things like mindful eating, which is how it was around before. And Dr. Angelova, I know you're a fan of Mr. John Kabat-Zinn, but his definition is the awareness that arises from paying attention on purpose in the present moment and non-judgmentally, which I think is a great definition, but I also think that's nice, but how do you do it? Is generally my first reaction. And so with mindfulness, my approach to it is from the dialectical behavior therapy approach again, which is DBT. Linehan has brought in a very tangible way of understanding things and being able to do things. And the thing with mindfulness is that if we're able to focus on the moment, right, and not be worried about the things that happened before, not be worried about what's going on ahead, not only are we going to be able to be more relaxed and more engaged in what's going on, right? So we're actually able to enjoy the company of other people, able to stop and smell the roses, but it actually can help us to be more effective in the moment as well. So with DBT, mindfulness is not only a way of being, this kind of calm and focused and in the moment, but also a way of doing things. So if we're able to focus on what we're doing, get one thing done, and then move on to the next, then we're actually be more effective with each thing that we do. This idea of multitasking tends to be, while popular, not actually the most effective thing. So focusing on one thing at a time, get it done as best as you can right now, and then moving on to the next. And Dr. Angelova, I'm not sure if you've got anything else to add with the mindfulness.
No, I think you've summed it up very well.
All right. You would have heard Dr. Angelova refer to emotional mind and reasonable mind. And those are actually from the DBT program as well, which is believing that we've got these different states of mind, the reasonable one, which is the rational and the logical one, the emotional one, which is all the emotion sides, the hot part, the impulsive part. And our goal with DBT is to bring us into the wise mind, which is the most helpful one in the moment, where we consider the emotions. We are aware of our emotions, but we consider the consequences before acting. So you can see how that really underlies a lot of the other stuff that we've talked about. All right. And looking at our social health, and I think that, as we're covering the different areas, it's important as well to know that depending on the person, there might be other realms that come into play too. So even things like, as we're getting into social health, Dr. Angelova and I were discussing earlier, this might cover vocational side of things, and work. It might cover we might have to look at the spiritual side as well. That might be something important to the person. So, even though we've broken it into the biological, psychological, and social, there's a lot of other areas as well that often come into our approach with understanding and supporting the whole person. All right, so looking at the social health side, humans are social creatures, and we tend to want to be around other people and want to have relationships with other people, or at least we have to deal with them on a daily basis anyway. So the social aspect tends to be a big part of what we do. And I'd say that 9 times out of 10, anyone I work with in addition to sleep, it is looking at relationships. So in looking at communication, a lot of the things that we'll do is to look at different communication styles, which I think is really helpful for understanding the interpersonal situations and interactions, because if we can understand our style, we can help to make some changes to help us be more effective in what we say or what we do in our relationships. So when I work with people, we'll talk about the 4 different styles. Quick breakdown is that aggressive tends to be kind of blunt, in your face, very demanding, and very focused on what they need and what they want in that moment. Catch with aggressive is that they tend to be, it might get what you want short term, but long term people don't tend to stay. Either they argue back or they leave. So the aggressive style is one. The passive style is another, which tends to be people who prioritize the relationship and just try to go with the flow. Again, short term, it seems to work because people like people who are agreeable. Long term, you guys can probably relate. If we're always having to do what the other person wants to do, we get resentful and we might blow up on the person or just cut off the relationship. Passive aggressive tends to be, I say it's anything you can snap your fingers or roll your eyes to. So sarcasm, and it's where your words don't match your body language. Yeah, they're real good friends. Oh, I love to go there. And so that one we kind of consider a lose-lose, because we're kind of expressing we're not quite okay with it, but at the same time, we're not saying what we want. So passive aggressive is one that can be confusing and might bring up mixed reactions in the person that we're working with, that we're talking to. And then the last one is assertiveness, which is being able to say what you need, to make a request, to set a limit, in a way that's going to be helpful and keep communication open. So if you guys have heard of things like I statements, you know, I feel this way when such and such happens. What I would like is, so for example, I feel frustrated when, when the garbage isn't taken out on Wednesday. What I would like is for us to come up with a schedule of how we can make sure it gets out to where it needs to be. If it's going to be at work, I've noticed that we've missed a couple of deadlines here. What I'd like is for us to come up with some ideas of how we can make sure that things are done in a more timely manner. Would be some examples of how we could use that. I think especially in Cayman, with us having such a diverse workforce, within the community having, I think last I heard it was 126 different nationalities in the island, it's really important for us to be aware of our communication and aware of how it's affecting others. Having worked in the States for many years, I know that the Caribbean cultures are often perceived as quite aggressive because we tend to be a bit louder and a bit more forthright. And so, there's easily cultural differences that come about. And so being aware of our communication, how it's affecting others, and being willing to tweak what we're saying or what we're doing to improve communication can really be helpful. So looking at the different communication styles, as well as kind of the bigger picture and looking at possible cultural differences is important. And with that, then we'll often look at conflict resolution, and this is something that we'll do individually with clients, and sometimes we'll do with teams as well. And so when I'm working with someone, and something didn't go right, whether it's talking to a boss or a partner, they'll be like, well, I said this, and then you wouldn't believe what she said. I'll be like, okay, what were you hoping would happen when you said that? Like, what was the goal of that conversation? And with that, we actually will take time to tease apart what's going on. One of my common examples is if you get home and the garbage hasn't been taken out, and you're mad about that, are you actually mad about that? Or are you mad because you got passed over for a promotion at work? Right? And so the first thing to do is to decide if there is a concern, prepare for the discussion. What is it that you want to accomplish with this conversation? Developing tools to effectively express yourself, things like the I statements. And these are all things that can be worked on with a coach, with a therapist. And something when I'm working on it with clients, I'll actually practice with them. If we're coming from an aggressive standpoint, it's hard to get the emotions down enough to say things clearly. If we're coming from a passive part, we often feel very aggressive, where we're like, could you please, or, what I would like is, it feels like we are being selfish or or domineering, and that's not the case. So practice in a safe place can help us to get the message across more clearly and us to feel more comfortable and confident in how we're doing it. Reflective listening, I say if you're doing that, use your own words. I had a gentleman who worked with me who was a primarily a Spanish speaker, and I described a project I wanted him to do, and he worked with my horses, who I love dearly. I described something, and he said, okay, and I got down that evening, and it was something completely different he had built. And I said, well, what happened? And he explained it to me. He used my exact same words, and this is what he did. And I realized that it was just a language and a cultural difference. He built what he understood I had asked for. So using different words to make sure that you're actually understanding. Things like a clean room, if for those of you who have kids, what does that actually mean? So that can be clothes off the floor, bed made, being more clear about what we're looking for. And whether it is asserting boundaries, making requests, and being comfortable for negotiation and compromise. And so Dr. Angelova actually offers mediation services as well. And so Dr. Angelova, it's okay, I'm going to jump to the next slide quickly and get through that. And then if you could talk about that for a minute.
Yeah, sure. So when negotiation and compromise don't work, then we can go to a mediation process where everything really gets unpacked, and all the conflict and all the communication differences and cultural differences. So everything gets put on the table, and it's really like a puzzle that gets taken apart, and then we have to build this puzzle again, but with everybody's input.
Yeah. And so that's, taking it to another realm and another way that we're able to help and support people as well as teams. And so looking here at building social support, and this comes a lot of different ways, especially in my work here, especially with young adults. A lot of times we see a lot of anxiety in social situations. So what we can do is helping with improving current relationships, so helping you to be more engaged, making sure you're spending more time with supportive persons. And this might be reassessing some of the relationships we have, if there's any toxic relationships or not so helpful relationships, maybe someone who is taking advantage or very critical of us or just has different values. And it may just be that you've grown apart over time, knowing it's okay to end the relationship, but even looking at how to do that is something that we can help with, as well as looking at bringing in new relationships as we grow and as we change, personally and professionally, and all the aspects that we have. Then it might be that we're looking for a new support group or just adding to the ones that we have, so we can also help people developing new relationships, finding new ways of meeting up with people, as well as improving confidence in those kinds of situations. By managing the negative thoughts that often go on as we're coming into it, as well as helping them be able to put their best foot forward and be most comfortable with that. All right. So thank you guys. That's a little bit of the different areas that we're able to help with. And as I said, a lot of those are there's a lot more information on each of those, but that's a little tidbit of the different ways that we're able to help with between therapy or counseling, or being able to even support with teams. Are there any questions about any of that? I know it was a lot of information. I would say, and if you don't want to put it into the chat or to speak up now, and I do know that we're very close on time, I have put up the general emails here, but you can also contact the Zest Wellness team. They can give you myself or Dr. Angelova's email if you like, or phone numbers if you'd like to contact us directly. In case you have any questions, anything that we've done or discussed today. All right. Well, thank you, everyone. We really appreciate your time and the opportunity to come and talk to you about some of the things that we do. I think you can tell both of us love our jobs and love being able to help people, and love being able to share a lot of the work that we do, and to let you know the different things that we're able to offer. Therapy is not just for people who are going through difficult times. Therapy really can be for anyone. Anyone who wants some more support, anyone who's making a change in their life, anyone who's been through a difficult time. And Dr. Angelova and I have dealt with everything. So both of us are doctor level psychologists and have worked in hospitals. So we've seen the whole spectrum. So we're able and happy and willing to support in any way that we're able to.
I just want to add to that is that you don't only need to see a therapist when you're in total distress. We also do, you know, we also like to see people reach their full potentials and become goal-driven and self-motivated. And a lot of the DBT and CBT that we do is also focused on that. So you don't only have to give us a call when you're in total distress. If you want to just reach your full potential and enhance your own life, then please feel free.
Dr. Bott and Dr. Angelo, that was fantastic. What we'll do just to close us out is we'll bring the floor back to Mr. Glenn Duran to share any closing comments himself, and then we'll close up here.
Just checking that you can you hear me, Nate?
Yep, we just heard you, Glenn.
Okay, good. Thank you, ladies, so much. Sorry to the audience for the technical difficulties that we had. It cut into some of our time, but it was very informative session. We definitely do have the contact details for Dr. Bodden, but we also have the final slide there with the details up. I can't see the screen, but if that's not up, we can put it up. You can put that up now, Nate. But again, thank you again. I think we've gone a little bit over our time, so we look forward to putting on more of these events in the future, hopefully with less challenges on the technical side of things. But we're very grateful for your expertise and what you provided for us here today. Also, if you guys wanted to, if you had simple questions that you wanted to ask, or you wanted to inquire, you can also contact Dr. Bodden directly, and just drop a note in the inbox or give a call. Yeah, and I think that's it from my end. Thank you so much. Thank you guys for listening, and thank you for your patience.
Yeah, well, thank you. You got to see stress management in action.
Yes.
Fantastic. All right, on behalf of everyone from the Zest Wellness team and Colonial Group International, thank you to Drs. Bodden and Angelova for your time and information today. And for everyone listening right now, the recording for this webinar will be placed on our Zest Wellness YouTube page. That said, thank you to everyone again, and enjoy the rest of your day.
Thank you.